My name is Roger Strasser. I'm the Dean and the CEO of the Northern Ontario School of Medicine, and it gives me enormous pleasure to welcome you here to this very, very special event. It's a major event, which I would expect will be a turning point, really, for health services and health workforce, access to healthcare for people in remote and rural communities right around the world. I do want to thank you all for joining us here today. And here today is in Thunder Bay, Northern Ontario School of Medicine, NOSM, at Lakehead University. Here in Sudbury, Northern Ontario School of Medicine at Laurentian University. And we're joined by the magic of video conferencing through the Ontario Telemedicine Network, OTN, in Little Current, and also in Moose Factory. And we are joined from Nunavut, from Iqaluit, by a video link as well, which when it comes up on the screen will say Ottawa. So you can interpret that as you choose. And then we have many other people joining us through the magic of webcasting here in Canada and actually beyond Canada. Of course, later this morning for us, which is the afternoon for them in Europe, we'll be connecting with our European Union partners and talking about the international Making It Work project and the experience in 5 different countries and how we've worked together. But right now, as we start here in Canada and with our wider group of participants today here in Canada, and I would like to begin by acknowledging that Northern Ontario, the vast territory of Northern Ontario, which is the campus of the Northern Ontario School of Medicine, is the traditional territory, the ancestral lands of the Indigenous peoples, the First Nations, and the Métis peoples. Here at Laurentian University, the Robinson-Huron Treaty, and at Lakehead University, the Superior Huron Treaty, and also acknowledge in Nunavut the traditional territory of the Inuit people. Bienvenue à vous tous. This is really going to be a very full and exciting day, and we do have some very special guests here with us. And I'll mention them, and then we'll have some introductory remarks before we move on to the part of the program here in Canada, which is setting the scene for the rest of today. So we have with us at Lakehead University in Thunder Bay, the Honourable Hajdu, who is the Minister for Employment, Workforce Development and Labour, and also she's the Member of Parliament, the Federal Parliament for Thunder Bay Superior North. And we have in the room here at Laurentian University in Sudbury, Franz Jelena, who is the Member of Provincial Parliament for Nickel Belt, that includes Sudbury, and she's the opposition critic for health in the Ontario Legislature. And we have with us also in Iqaluit got Dr. Gwen, Healey, Akearok, and here in Sudbury, but from Nunavut. I should say that Dr. Healey Akearok is the Executive and Scientific Director of the Qaujigiartiit Health Research Centre, which is in Nunavut, in Iqaluit. And then also from Nunavut, but here in Sudbury, we have Stephen Tuart, who is the Territorial Director for Medical Affairs, Government of Nunavut. And also here in Sudbury, Dr. Francois Devet, who is the Nunavut Territorial Chief of Medical Staff. And so welcome all of our special guests, and we'll be introducing some others who are with us in Nunavut as well shortly. So this really is a very exciting event, as I said, and it's the culmination of a 7-year partnership across the Atlantic Ocean, working with partners in northern countries and focused on remote rural communities in the far north of these northern countries in Europe. And so as the most recent project we'll talk about, Making It Work, this is funded by the Northern Periphery and Arctic Program of the European Union, so Canada's in the Arctic, and it's been wonderful really to work with partners in Nunavut for this particular project. This afternoon we'll be focusing more on Northern Ontario and what we can learn from the experiences internationally in addressing the continuing issues of access to healthcare, of the supply of physicians and other members of the health workforce here in Northern Ontario. And I hope that you'll all be able to stay with us for the whole day. We have an exciting planned afternoon session which will report on a summit, Health Human Resource Summit North, that was held in January last year in Thunder Bay, and the work of the Northern Physician Resource Task Force that followed from Summit North, and the Northern Physician Resource Action Plan, the sustainability plan that is a result of that work. And we'll be focusing on that this afternoon and looking to taking that into the implementation phase in terms of the action plan. So we have a very full day ahead of us, and I'm very excited about it, and I'm sure you are too. Without any further ado, I'd like to ask our first special guest to say a few introductory remarks, and in particular, this is the Honourable Patty Hajdu. I mentioned that she's the Minister for Employment, Workforce Development and Labour, and the MP for Thunder Bay Superior North, and it's actually her department that funded the Nunavut Health Careers Camp, which you'll hear about as part of the international presentation, part of the Canadian case study. So without any further ado, I'd like to hand over now to Minister Patty Hajdu.
Well, thank you very much, Dr. Strasser, and it's a joy to be here with you on the traditional territory of Fort William First Nations. Je suis très fière d'être ici à Lakehead University de Lakehead University. I am a graduate of Lakehead University, an alumni, and so it's always a pleasure to come back and celebrate the school and the contributions that Lakehead University and NASM in particular has made, not just to the city of Thunder Bay, but to the region as a whole. I would argue to the province and the country, but their record speaks for themselves. And you know, Northern Ontario School of Medicine is something that I think all residents of Northwestern Ontario are incredibly proud of, and the vision of Lakehead University and Dr. Strasser and those who had the vision early on. Many of them might be in this room, that to have our own medical school in the north was really a legacy piece that allows us to have better medical care across the region, to attract new people to our region, and to retain people that are interested in a career in the medical services. And more than that, I think the way that the services medicine is taught in Northern Ontario School of Medicine is completely unique and has been recognized across the country, in fact, across the world. And so it's really a jewel for us here in the North. And I hope I'm not boasting too much to our international partners, but it's something that I'm incredibly proud of, and I know that many other citizens are incredibly proud of, even if they've never stepped foot in these doors. It's something that everyone knows about and is so proud to have here in our own home. I also will say that I have some understanding about recruitment and retention. I was the executive director of the largest homeless shelter in Northwestern Ontario. For those people who are from here, they know about this shelter, but it was a shelter that provided care and access for people who were the most vulnerable in our community. It was a low barrier shelter, which meant that people who were using substances and who were actively intoxicated could seek shelter and would not be turned away based on their substance use or their state of intoxication until it became, of course, a medical emergency. That's a whole other story that I'd love to tell someday, which was a big challenge. But one of the biggest challenges was recruiting and retaining professionals that would work at the shelter. And so there were many, many layers to that about why it was hard to recruit people, and then how it was so difficult to keep them once they were there. What we found, and I'm actually fortunate to have my career journey. I have a career partner, I guess, in Crystal Deputer, who works for me now as my constituency manager, but was my HR coordinator at the time. And I just want to thank Crystal, because I learned so much about HR with Crystal and part human resources. And part of the challenge was, convincing the board at the time, which was incredibly strapped for money, not for profit, that wasn't well funded, that about a third of our budget was we were responsible for raising ourselves, and so you can imagine that salaries were not very high, and in fact that kind of work is not valued in our society. Care work in general is not valued very well, especially frontline care work. And so we were in a really vulnerable position where we would recruit new, exciting people who wanted to work in that field, and yet weren't compensated well. Oftentimes, didn't have the supports that they needed in order to stay healthy emotionally, and in that circumstance. And I'm sure these are stories that resonate for healthcare professionals and leaders, because it's a similar kind of thing where you're working with people who are very vulnerable. It's demanding, and depending on the level of care that you're providing, you may not be very well compensated. And so, we learned that retention was crucial, and that anything that we could do to keep people not only was good for the organization in terms of our ability to deliver excellent services, but it was also really important for our bottom line, because recruitment and training and all of that goes along with that churn is extremely expensive. So the work that you're doing in terms of talking about rural areas and remote areas, and how we attract people to either stay in rural and remote areas or choose rural and remote areas to work is critical, because in fact Canadians across the country who live in these areas deserve the same level of care as everyone else. And I can tell you, as a member of Parliament who serves a very large riding with many people that live in very remote communities, and communities that often don't have medical specialists, that have to travel in some cases hours and hours to get to the city, sometimes multiple times a week. This is critical to their wellness, to their sense of equity, to their sense of health, and to their health outcomes. And I will say that it was really exciting yesterday. We had a cabinet shuffle. For those of you from other countries that are listening in, you've got some political excitement, I know, of your own happening, but we had some excitement here in Canada as well. But one of the pieces of news that I thought was maybe wasn't focused on as much yesterday was we have a new minister for rural economic development. And, this minister is a reflection of the challenges that we've been hearing as a fairly new government of 3 years around access to services in rural communities. So as the Minister of Employment, my job is to support people to have that best chance at success, no matter where they live, no matter what their circumstances. And, I always talk about this with young people that, so much of what happens to us is a result of our birth location, and that a government's main job, I think, is to level the playing field. And so as the Minister of Employment, one of the things that I take the most pleasure in is looking at the programs and services that we offer through our particular opportunities to fund programs, and whether or not they're actually resulting in equity, whether or not the people have equal access to the kinds of supports that are available through the Government of Canada. And so, this journey that I've been on has included things like taking a look at the youth employment strategy that has been in existence for a long time in Canada, and asking ourselves, is it actually delivering supports for young people in equitable ways, and are vulnerable youth able to use those services, and do they actually help vulnerable youth change their trajectories in terms of employment opportunities. There are some really great examples of programs, and Dr. Strasser briefly touched on one that we've been funding, and one of them is the Nunavut Health Careers Camp, which has been funded in part through the department that I have the opportunity to lead. And the Nunavut Health Careers Camp is a perfect example of, I think, one of the winning strategies to strengthening the workforce in rural communities, and in particular the work that you're doing around medical professionals. Because what I think about when I think about youth is so many youth don't even know what careers are out there, and what, they have these very stereotyped broad buckets, if you will, of, what potential careers might be out there, what potential jobs might be out there. But they've never really been exposed to the breadth of those particular sectors, or the opportunities that might exist in their own communities. And so something like the Nunavut Health Careers Camp provides a window into the world of opportunities that might be, in this case, in the sector of healthcare. So it gives young people in Nunavut, and I don't want to steal anybody's thunder, but, experience or tactile experience, really, if you will, a hands-on work experience in things like making casts and doing stitches, so they can actually feel what it feels like to do that kind of work. Insight into the wide variety of the different kinds of professions that fall into that sector of healthcare. What kinds of professionals are needed in their region, in the country, and what does it look like to be a physiotherapist or a mental health professional, an occupational therapist. I think back to when I was 17, going into university for the first time. I was the first person in my family to graduate with a post-secondary education. I changed my major about 3 times in 2 years. I remember looking at the political studies students in the college. The university that I went to had a college called Glendon College, fairly famous for its political studies program. And I couldn't even understand what that was. And that's a reflection of young people, really. I mean, if you're not exposed to a wide variety of thinking or a wide variety of reading or a wide variety of career potentials in your family or in your in your undergrad or in your K to 12 experience, there's no possible way that you can actually make good decisions that are going to lead to a career that's satisfying for you. And so for me, it combined with multiple other challenges, it led to me dropping out of university and not going back to Lakehead University until I was a mature student and graduating at the age of 28. So I tell that story because I think it's so important, the work that some places like the Nunavut Health Camp are doing in terms of exposing people to just what might be out there and tapping into young people's natural interest in the world and giving them that vision to what that might look like and translating it into their own life and potential. So we are also boosting up the supports that we're providing to provinces and territories under the labor market transfer agreements, which I think is the most boring word in the world, most boring title in the world. We're providing provinces and territories with about $3 billion in ongoing funding, an additional $2.7 billion over 6 years. And this is really important because this supports those kinds of programs like the youth employment services that we have here in the city, or the college career center, those kinds of centers that are working with young people that are struggling with direction, that don't necessarily have, even in some cases, the most basic soft skills that are going to allow them to even land an interview with an employer, helping them develop those skills, their resumes, their opportunities, their pathways. And I think, despite the boring title of this program, it's one of the critical ways that the Government of Canada supports skills development across the country. And one of the exciting things for me, and I think all of the scientists in the room will appreciate this, is that for the very first time we're going to be measuring outcomes with a labor market transfer agreement. So we've managed to negotiate with the provinces a shared outcome measurement approach, and provinces will be benchmarked as well against each other. Now, this took some wrangling, if you know anything about provincial transfers, because of course provinces don't like a lot of strings attached to the money that is transferred. But we think it's important that when we're spending that kind of money, that we actually know it's delivering for Canadians, that we know that the programs are resulting in the kinds of outcomes that Canadians expect. I always say that with also a word of comfort, I would say, to service deliverers. This isn't about cutting programs. This is about really identifying what's working and then amplifying that and giving ourselves the information and the data that we need in order to move on from perhaps approaches that are not working and move towards approaches that are going to be more successful for the people that are relying on them. I would also say that when I think about the challenges that rural communities face, we talk about attracting people to the rural communities, but I look at some of the work that the First Nations communities have been doing in my own riding, and I'll talk about Bitigong First Nation for a minute because I think it's a shining jewel that if you haven't had an opportunity to visit Bitigong or get to know Bitigong, please reach out. They'd be happy to, I'm sure, show you around. We have an incredible asset in our northern and rural communities, and that's young people and middle-aged people who want to work, who want to contribute to their communities, who want to stay in their communities, who love their communities. And yet we don't provide those young people with the opportunities to do just that. And so I think part of my job as a minister and part of your job as educators is to find a way to help people stay in their communities and contribute to their communities in meaningful ways. And the reason I raised Bitakong is because 40 years ago, and this is a story that Chief Mashano told me, Bitakong made a commitment to the education and social well-being of their children. Despite what governments were doing, despite whether or not it was a liberal government or conservative government or they had funding for a program or not, they made their children their priority. And they made, in particular, education of their children their priority. And now that community is staffed by and large by Bitakong members. Not completely, because of course every community has newcomers and faces that come to that community for a whole bunch of reasons. But if you visit their early child care center, it's Bitakong residents who are running their early child care center. If you visit their school, it's Bitakong residents who are teaching their children. If you visit their healthcare center, it's Bitakong residents who are providing much of the care in their healthcare center. And to me, that's a model of success. Yes, we have to recruit people to rural and remote communities, absolutely, because we have aging populations. But let's not forget about the populations that are there and providing those populations with the supports that they need to contribute to their communities, to stay in their communities, to live those lives that are secure and dignified, to provide for their families, and to feel like they are contributing to the communities in meaningful ways that are going to meet their interests and their career aspirations. So I want to thank you very much for the work that you're doing today. I think sharing best practices across the world is an amazing model. I know that I'm sure you'll hear similarities and you'll be able to share some of the differences. And again, I'm just extremely proud of Lakehead University and Northern Ontario School of Medicine for what you do to provide excellent health care across our region and, in fact, across our country. Thanks very much.
Thank you very much, Minister Hajdu, for those introductory remarks, and I think your words really have helped to set the scene for the forum for the rest of today. I'm now going to ask Franz Jelena. I mentioned that she's the Member of Provincial Parliament for Nickelbelt here in Sudbury. She also has a long association with NOSM, as she was the chair of the Francophone Reference Group of NOSM before she went into politics. So, thank you, Franz.
Thank you, Dr. Strasser. As it was mentioned, my name is Franz Jelena. I'm the MPP for Nickelbelt. Nickelbelt is one of those big northern riding. I have 33 small communities, whether you talk about Ivanhoe Lake or Folliet, Matagami First Nations, Gogama, Bisco Tasting, Westry, Shining Tree, and the list goes on. Most of them are too small to be a city or a village. They are little communities throughout the Northeast. They all have something in common. They all have a hard time recruiting and retaining health professionals to give equitable access to the people who live in those communities. So I cannot tell you how proud I am of what's going to happen here today. For the first time ever, Northern remote rural community will have a body of evidence that shows the world as to how do you recruit and retain health professionals in Northern Ontario and throughout the world so that we can provide equitable access to all. I can tell you that this is something that in my mind I have been dreaming of for a long time, that brilliant people like you would put their minds together to bring us solutions that make sense in a remote, in a northern, in a rural communities, which are the communities that I represent, and which are the communities that are all over Northern Ontario, where the Northern Ontario School of Medicine practice. This is an important day. From this day on, I expect each and every one of you to push this idea forward. There is a role for the government to play to make sure that the strategies that have been worked on, that have been studied, that are now being put forward and shared, are being implemented so that we finally gain the benefit of bringing equitable access to healthcare, no matter who you are, no matter where you are in Northern Ontario and throughout the world. This is big, this is exciting, and it is happening today. So really proud of all the work that you have done, happy to learn about this work, and if I can be helpful, if I can be useful, it will be my pleasure for me to do this. Merci beaucoup. Thank you very much. Chimiwech.
Well, thank you very much, France, and also Patty, for your opening remarks. I'd like to draw your attention now to the program for today, which if you're in the room here at Lakehead University or here at Laurentian University, you've been given a hard copy, and also the Making It Work framework, the summary document, which was circulated as a PDF and again is available as a hard copy. We have about 10 minutes left in this part of the session to set the scene now as we introduce you to the day, and in particular introduce you to the work that NOSM has been doing in partnership with Nunavut. Before we do that, I just need to quickly introduce the fact that physicians participating in this forum have the opportunity of gaining credit, continuing medical education credit. Actually, could I ask anyone who's not speaking to go on mute, please? I'll be saying this a number of times, and someone seems to have gone off mute because I'm hearing sounds behind me. So wherever you are, if you could go on mute, that would be well received. Okay, I'm going to keep talking, and hopefully Aaron will be able to sort out where this is coming from and keep us going. So the presenters today, both in Canada and beyond, have no conflicts of interest to disclose. I've mentioned already that the European Union Northern Periphery and Arctic Program is the funder for all of these activities, including today. And we have learning objectives, and I'm sure that you've come here because this is what you want to learn today about the various concepts and implementation strategies, focus on priorities, learning from the experiences in the partner countries, and working on where the gaps are and what next we need to do. And this afternoon we'll certainly be focusing on what next we need to do in Northern Ontario. We are in a situation, as both the introductory speakers have said, where we have an enormous challenge for remote rural recruitment and retention. And I think it's important to understand that each community in remote rural areas of Canada, of Northern Ontario, of Nunavut, and our partner countries, they're all different from each other, and they have specific needs which are different from the larger population centres. And the major challenge is the coming and going, the transience of healthcare providers, and so that tends to lead to being a focus that's all about filling gaps and keeping going and so on, and not really making changes that have long-term impact and change the scenario for the community. Northern Ontario School of Medicine, NOSM, has been involved right through. So in 2011, under the Northern Periphery Program of the European Union, we were a non-European partner, but we brought expertise, and we're certainly very much part of that project, the Recruit and Retain project that focused on recruitment and retention of health and other public sector workers in remote rural communities in the far north of northern countries in Europe. And then the Northern Periphery Program finished in 2014 and was replaced by the Northern Periphery and Arctic Program. And Canada's in the Arctic, so we're a full partner in the Making It Work Recruit and Retain project, which today is actually the final forum of that project. And here you can see we've met several times in remote rural communities in Europe. This is actually in Scotland, in a place called Ullapool. And so you can see our partners there. And that theme that I mentioned, that we have so much in common, these are pictures that are taken in different communities in the far north in our partner countries, and you can see the view of the world with the North Pole right in the centre there. So for NOSM, we saw the opportunity, we recognised similarities between Northern Ontario with the vast distances and the small communities and Nunavut, and approached the government of Nunavut saying, well, no, we've had some residents come and go and some other interactions with Nunavut, but how about coming together and working together. And there was a lot of interest. There was an interest in health careers camp for high school students. There was interest in more residents in a more systematic way, working together and improving health services, and also education, continuing education, professional development for the physicians. And so when the opportunity came with the Northern Periphery and Arctic program, we approached the government of Nunavut and the Nunavut's Inuit organizations and agreed to work together and formed a very strong steering committee that guided this project. And other partners came along, like the Northern Arctic College. I'm now going to ask Gwen Healey Akearok to take over, and she's going to give you a quick window on Nunavut and the situation in Nunavut. So over to you, Gwen.
Okay, good morning. I hope you can hear me. Maybe you can give me a thumbs up because we had audio issues. Okay, great. So Gwen Healey Akearok yung ikalom yutaw yung ilisa yung Northern Ontario School of Medicine may ang isimokto yung Qaujigiartiit Nunavut me. So my name is Gwen Healey Akearok, and I'm the Executive and Scientific Director of Qaujigiartiit Health Research Center here in Healey. I'm also an assistant professor at NASM. And it's my pleasure to welcome you to Nunavut, to our windowless room here. Unfortunately, you can't see outside, but the sun is just coming up. And so it's my pleasure today to orient you to our territory and our beautiful communities and our healthcare system. We have 25 communities spread across 2 million square kilometers of our vast, beautiful land. Our population's a little over 35,000 people now, and 85% of our population are Inuit, speaking 4 official languages: English, Inuktitut, Inuinnaqtut, and French. We have the fastest growing population in Canada. Nunavut has the highest birth rate, and our population is very young, with more than half of our population under the age of 25. If you could advance the slide, please. Our healthcare delivery model is based on a remote nursing station model that was implemented in different jurisdictions in Canada around the 1950s. And in Nunavut, we have 3 distinct healthcare service regions. So in the green, in the eastern part of Nunavut, the Qaujigiartiit region comprises 12 communities. And in the central part of Nunavut, the Qaujigiartiit region comprises 8 communities. And just outside the map there is also Sanikiluaq, the 8th community in the Belcher Islands. And then in the west, we have 5 communities in the Qaujigiartiit region. And across those 25 communities, there are 22 community health centers, and then 2 super health centers, which are regional hubs in Rankin Inlet and Cambridge Bay. And then here in Iqaluit, we have the one and only hospital, the Qaujigiartiit General Hospital. Next slide, please. The health centers are staffed by a variety of different professionals. So, of course, all of them are staffed by community health nurses, and they have a very wide and broad scope of practice. They provide all the emergency care and clinic appointments, and then the centers are also staffed by community health representatives who are usually local community members who've been trained as community health reps, and they do a lot of the public health work. So working, providing presentations to the community, working with the nurses in different ways, and vaccination clinics and screenings and things like that. Some, but not all health centers have mental health nurses. All health centers have interpreter translators who play a really vital role in our healthcare system, where we're working in different languages and different terminology, so they're really a critical component in how the healthcare system is implemented. And then other important staff that may or may not be in any given health center include X-ray technicians, telehealth technicians. Some health centers are staffed with nurse practitioners, and then other project-specific staff and nursing students, and people come and go from the health centers. Next slide, please. So above and beyond that, we have a referral system as part of our healthcare model, and so tertiary services are accessed in major urban centers. For us, in the west, their hub is Yellowknife and then Edmonton, and in the central part of Nunavut, their hub is in Winnipeg, and then here in the east, our main tertiary care center is in Ottawa and at times Montreal as well. And so for all of our specialized services or any sort of major incidents that require medevac, they're referred to those larger centers. So we have rotating specialists that come in from those centers, and then our patients and clients go down to access services as well. So this is the most northerly health center in Canada, the Grise Fiord Health Center, way up in the most northerly part of Nunavut. Next slide. And this is the west wing of the Qaujigiartiit General Hospital here in Healey, which was built in 2008. And then just to the right of it, outside of the picture, is the east wing of the hospital, which was quite a few decades older than that. Next slide, please. And then here in this photo, these two photos, we have the two regional hubs in Cambridge Bay on the left and Rankin Inlet on the right. And so in the Rankin Inlet regional hub, they also include a birthing center, which is staffed by midwives. And Cambridge Bay, I believe, also has one or two midwives on staff now as well, which is exciting. Okay, well, I think it goes back to you now, Roger.
You are the only participant in the conference.
Thank you, Gwen, for that brief introduction to Nunavut, and I think you can see that there are many similarities. Those of us who are in Northern Ontario, I talk about Northern Ontario as having a vast geography. Nunavut has an ultra-vast geography. Tiny communities, large distances, only accessible by air. So almost Northern Ontario on steroids, you might say, is the situation there. But you can see, therefore, the potential for the collaboration that we've developed with Nunavut, and drawing on the experiences in other countries which are like Nunavut in the Arctic. And so that's been fantastic. I want to just draw your attention to this summary document, and if you open up and look inside the cover, the first page, this is the framework document. This is really the result of 7 years of study, research, looking at lessons learned from other settings. After Recruit and Retain, there was a solutions report which had 29 tried and proven initiatives that improve retention recruitment. And now this project, Making It Work, is implementing a selection of those solutions in different jurisdictions. And for us, the jurisdiction is Nunavut. Shortly, you'll hear from the other country partners, but I just wanted you to focus on this. You can see it looks deceptively simple, but there's a lot to it, okay? Plan, recruit, retain. And then with each of these themes, starting with focusing on assessing the health needs of the population, designing a service model that addresses the health needs of the population, ensuring that the care providers actually have the right range of knowledge and skills to actually provide the services that are needed. That's really important. It's also important then that the recruitment process is actually effective, and you'll see in the center of the plan of the recruit is community engagement. And actually, if you're really smart, you'll see that there's in the center, the conditions of success, engage residents. Active community participation is an essential element to success, a contributor to success when it comes to retention, recruitment of health and other public sector workforce in remote rural communities. And it's all very well to recruit. It is important, as I said, that communities are actively involved, because when you recruit a physician or a nurse or a pharmacist, a community health representative to a community, there's usually a family. And the family needs to feel at home and want to be in that community. That then contributes to retention. There needs to be a supportive work environment, and so that the healthcare providers are really part of a team that are working together and supporting each other with regular updates and training and continuing professional development, and focused on recruiting successors, the future care providers, and that's where education and training comes in. So that's a quick going around the plan, recruit and retain, but I want you to look in the centre. For Canadians, this is the Tim bit. This is the bit that's the tasty bit in the middle that really, really, really counts, okay? Recognising first that every remote rural community is different and has specific characteristics that need to be understood and addressed with active community participation, as I've said. And this doesn't just happen. There has to be genuine investment of real resources to actually achieve the kind of success that we're talking about. And it doesn't just happen once. It's a continuous work in progress, and hence you need to have an annual cycle of education, training, recruitment, retention, community involvement, and you need to measure, to monitor, to ensure that what you're doing is having the desired effect, and then adapting as you go. So that's just a very, very quick introduction to the framework. We're now going to take a break for about 10 minutes as our international partners connect with us, and then as I say, in 10 minutes' time, we'll then move to the international part of today's forum. So this is an opportunity for you to study. If you haven't read, now's your time to study. And you can have a chat amongst yourselves, grab a cup of coffee, and we'll resume in 10 minutes' time. Thank you.